got a blood test for an insurance thing that my PSA had got high. They examined me, the rectal exam where they feel the prostate. They couldn't feel anything. And everybody said, probably don't, but you should get it checked out.
Went to my regular doctor to begin with because I was having some problem with the bladder, and they diagnosed it as a prostate infection at first and prescribed some medicine for that. And it seemed okay for like a week, but then the symptoms came back again after that.
I couldn't urinate. I mean, or it was difficult. I really had to push to urinate. It was getting progressively worse. My general practitioner originally thought it was prostate problems. Was treating for that, wasn't helping.
You really worry about it. You know, it's something that you try to be the big tough macho man and all this kind of stuff, and not pay attention to it. Yeah, it bothers you. And you start thinking, well, how many days have you got left?
They did their tests, and they found out I had a tumor in my bladder, and they thought maybe they could scrape that out to begin with. So they did a small surgery of scraping that out, but the cancer had permeated into the bladder wall, so they had to remove the whole bladder. And then I was referred to Dr. Holzberlein.
They'd been having to basically dilate me for my urethra about every 6 months.
The waiting period is the hardest. When you wait between trying to find out whether you have something or not, that's always the hardest. After
I would be dilated, I would be fine for a few weeks, and then maybe after about a month I could feel that it's getting progressively, tighter and more difficult. And by the time the end of 6 months, I would literally be pumping it out in squirts.
We came up here and Dr. Thresher wanted to do a biopsy, and it showed up that I had cancer on both sides of my prostate. He said, you can't feel it or anything else. And I didn't even have a real high PSA. It was in the upper fours. My urologist said he could do the surgery, but they've done so many here that he'd feel better if I came here.
And he said, this isn't working for you. You're too young for this. By the way, there's this doctor at KU Med who has this new procedure that I think might be what you need. So he referred me to Dr. Thrasher. Dr. Thrasher came in and introduced himself and explained what the procedure would be and what further tests would be needed to determine whether or not I would be a good candidate for this particular surgery.
It wasn't just I came in and I'm just somebody to cut on or anything like that. He really cared.
All very professional, very caring, very to the point.
Any question I had about it, he had an answer instantly for me. Just real personable, just eased your mind, made you feel like not just a patient, like he cares about you as a person.
He's one of the nicest guys to sit down and visit with and work with I've ever met. He makes you feel very comfortable, but more than anything else, he gives you hope. Hope is the most important thing that you have going for you right now. And he is a wonderful, wonderful man when it comes to giving a person hope. And his staff and everything that they do is geared toward that.
After talking to Dr. Holzberlein, I felt certain that he was going to take care of the problem that I had, and he did.
There's no pain when I urinate, and that's a good sign. Dr. Thrasher and his residents, when they've looked at me, have been very pleased and ecstatic, and have told me that, oh boy, this is turning out great.
I went into surgery at 7 o'clock in the morning on Monday morning, and at 9:30 Tuesday morning, I was up walking the halls of the hospital.
It's great. I mean, I've got the function of everything that they messed with my bladder. I don't have a bladder, I have a neobladder, but it works like a bladder does, pretty much, and my erections are fine now. It took a while to have the nerve damage grow back, but they're all fine now. I can do anything I used to be able to do.
The longest incision is about like this. There's several of them. They're small. I've never felt any pain from any of them.
And basically it was explained to me this way, that this surgery is 95% successful. If you're one that would fall into the 5% where it was not successful, you wouldn't be any worse off than where you were. You'd be doing the exact same thing, coming in every 6 months. So when you're looking at it from that perspective, 95%, yeah, why wouldn't you, want to do this?
At home, I took it easy for 2 weeks, like they advised, but I still worked. I had my own business, and I slept and rested a bunch, but mentally and physically, I felt very good.
Considering what my lifestyle was before, would I do it again? Yes. Yeah.
I guess I was really surprised how fast I did recovery, and I felt normal. I was really surprised.
Gave me a whole new lease on life. I mean, my life is relatively normal. I mean, compared to the options that I could have had, with the colostomy bag and all that, and I don't have any of that. Everything works pretty well like it's designed to. Actually,
it's turned out much better than I expected. You've heard all the horror stories all your life growing up. If you get your prostate removed, sex life destroyed, your drive and all that's gone stuff. I've experienced none of that.
Actually, Dr. Holzberline's had some patients that were thinking about having the same surgery call me and discuss, what the future holds in store for them and all that, and I've got no problem with it. Recommended Dr. Holzberline for any of that.